look at my nursing home as a nursing home per se. I look at it as a home.
Okay.
A home for comfort, love, peace, and to restore. We do at nursing home. We put out special attention to our patients.
Yes.
And because why they put out special attention to them, because they are not getting it at home, so an individual want their people to get very much attention and to be cared for. So that's all right. For instance, they used to play the guitar.
Yes.
And they have a guitar, and the family have the guitar, want to bring it. We don't stop them because that's their comfort. That's a part of their healing process also.
Okay.
So we let them come and they will play the guitar. We don't really have a limited time for them to play or not to play. We just give them their franchise to play. And we have like card games, dominoes. We have like bingos and those little games. We play them. Sometimes we go out in the yard and we have a chat. We sit in the garden. We have little chat and stuff like that.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In office with me today is nurse Christine White, and she's actually operator of a nursing home, and she actually has years of experience, probably over 20 years experience in operating and working at nursing homes, all right? And today in office will be held at White Wing Care and Nursing Home, right? So Nurse White, I'm just gonna say it as Nurse White, all right? So welcome to the show In Office.
Thank you for inviting me.
Okay, all right. Now, nursing home. We do at nursing homes. Why is it necessary?
It's a lot of things we do at nursing homes. We put out special attention to our patients.
Yes.
And because why they put out special attention to them, because they are not getting it at home. So an individual want their people to get very much attention and to be cared for and to extend wider love to them. So they put them at nursing homes. So people at nursing homes intends to take special care of those people that is in need of care.
Okay. So what would be some of the conditions that these persons have why they would need to stay at a nursing home?
Okay, some people are bedridden from various illness. Like some people have like heart problems, arthritis comes with it, kidney failure and stuff like that. And they have their loved ones, but they can't care for them the way they wanted to care for them. So they put them at nursing home and ask us to care for them.
Okay. So in terms of the nursing home facility, so these patients normally have their own rooms or the share room or just a open wide area like a hospital ward?
No, it's not an open wide area. They have individual rooms.
Individual rooms.
Some have individual rooms, that is private room, and some are share rooms. Like we have 3 persons in a room. We have a room with 1 person. We have another space with another 1 person for now, but that space is a shared space. So some people walk in and say, oh, I want my mom or my dad to be here, but can I get a room for them alone? So they make every effort to get that room for them alone.
Okay.
And
alright, no problem. So is it a case where you only cater for elderly person or you cater for persons of different age groups which might have different types of disability?
Fine. We care for people who have different disability. Not the age is not the per se. It's the sickness that comes and stuff like that.
Okay.
So what we do now, we have, for instance, we have a patient here that is 23 years old.
Okay.
But our reason for being here because she has a disability and her family want her to get that 24-hour care.
Okay. All right. Now, I know that nursing home, it would, now when persons are at home, it's a smaller setting, but nursing homes, some nursing homes are extremely large and have several different residents there, right? And we know with healthcare, wherever we have so many persons together, we might have issues with infection, all right? So one person may have like infection, like even like flu or other contagious respiratory or even other skin infection. What are some of the measures that you guys normally take to minimize these infections from spreading from one person to the next, especially like during COVID-19?
Okay, during the pandemic, I did not start up my nursing home as yet.
Yes, but you were working.
Right.
You were working at nursing home.
Yes, I was working at nursing home. So we wear special gears, protective gears, to protect ourselves and to protect others, and we sanitize frequently.
Okay.
And we don't use the same gloves, and everybody, with each person, we change the gloves, we wash our hands, we make sure we are proper sanitized to approach the next patient and stuff like that. And we exercise our mask frequently and all that.
All right. And I know that these patients can have different conditions and requiring medication, sometimes even for doctor to visit the facility. But in terms of medication, how do you guys normally manage to like to medicate everyone and ensure that they are getting their correct medication on time, etc.?
Okay, we have an RN nurse that comes in and makes sure that all prescription is filled.
Okay.
And all medication is the right medication we got from the pharmacy, because sometimes it got mixed up.
Okay.
And we have them put out in numbers and letters order, so we can just administrate it when the time for medication. When it comes to medication, we're very careful because we don't want them to get mixed up, and we don't want to give medication when it's not supposed to be given. If a patient asks for a painkiller throughout the time when they're supposed to get their medication, we go back to their bucket and we look and see what time they got, and we sometimes we confirm with the doctor if they can get this one.
All right. Another thing I noticed at nursing home, you guys check vitals like 2 times a day sometimes. But I understand that you're checking the vitals, they're essential, you know. But sometimes I wonder if the residents might feel like they're at the hospital to be checking their vitals 2 times a day, and like the blood pressure, I see blood pressure being checked 2 times per day sometimes. I see blood sugar being checked. How do you manage to let the residents feel like they're actually in the comfort of their home and not necessarily at a hospital? Because in my mind, I would feel like I'm at the hospital if I'm going to be checking my blood pressure 2 times per day.
Okay, what we do here, we don't want them to feel like they are in the hospital. We want them to feel like they are into a regular home, maybe with different people, but make company with them and becomes a family after a while. We don't check blood pressure 2 times or 3 times per day unless the person, when we check the blood pressure in the morning, it is too high or the blood sugar is too high, we will do a second check in the midday. And if it's still too high, we are going to call the doctor and confirm with him, and we are going to give it another check in the evening, and we are going to monitor that person thoroughly for the day.
Okay.
But the rest, if you don't have those problems, we only do the blood pressure in the morning to make sure that you wake up to a good morning, you're not feeling any hangover or anything. So we check the vitals in the morning and make sure you're fine.
All right. But I'm saying that if it's a case where the resident here at the nursing home don't have high blood pressure, right? So for example, is a patient with a normal pressure, so not having high blood pressure, not taking any medication for high blood pressure, why would you still go ahead and test the blood pressure at least once per day, and the person is not on a blood pressure medication? Okay. Is it a requirement from the ministry that the vitals are checked at least once per day?
It's both a requirement from ministry and a requirement from the nursing home to make sure that the person don't develop blood pressure overnight. Because as we all know, we can born with blood pressure. We can develop blood pressure at any cost, by the food that we eat, by how we rested or whatever. We can, get up this morning and our pressure is like 200 and by midday it's gone down. So it's very important to do their vitals in the morning to make sure that they are okay and they don't develop overnight blood pressure or eat something in the night and it send up the sugar or something.
Okay.
So it's very important.
All right. Since you mentioned about food, in terms of the food for the nursing home facility, is it normally that the cost for the nursing home on a monthly fee would include that for meals at your facility, or is it a case where they have to purchase meals different?
No, it's a case that we provide food from the cost that we charge.
Okay. Alright, but we know that sometimes some patients might have special needs, like for example, a patient with, so for example, a kidney problem, diabetes, hypertension, sometimes may require slightly different meals. How do you facilitate that? And most likely you'll be cooking one big meal for everyone. Or some persons may be on soft diet, some persons may need regular food.
Okay. What we do, we have a listing that we know what they eat and what they don't eat.
Okay.
So we try to provide what they eat. If, for instance, we have a set of them that don't eat rice,
Yeah.
so we know we have to cook ground food every day.
Okay.
And we have to cook rice, not every day, because those that eat rice, they will eat ground food also.
Okay.
So we minimize on that. And we ask the family member to bring in like snacks and juice,
Okay.
water if they can, and fruits for them. Because sometimes the fruits, you serve fruits at the nursing home, but they want more than what you offer.
Okay.
So you ask the family just to pack up their fruits there a little more.
Okay, that's a good idea. Alright. No, so apart from meals, right? You know that normally for someone to feel like they're at home, they would normally need to include some amount of leisure activities, apart from just watching TV, of course. What are some of the leisure activities you offer at your facility in terms of like if anyone wants to have a hobby like say singing or playing some form of instrument or support? Any
Okay.
area at your facility would accommodate those stuff?
If a person that's, alright, for instance, that used to play the guitar,
Yes.
and they have a guitar, and the family have the guitar, want to bring it, we don't stop them because that's their comfort. That's
Okay.
a part of their healing process also.
Okay.
So we let them come and they will play the guitar. We don't really have a limited time for them to play or not to play. We just give them their franchise to play. And we have like card games,
Okay.
dominoes,
Okay.
we have like bingos and those little games. We play them. Sometimes we go out in the yard and we have a chat. We sit in the garden. We have little chat and stuff
Okay.
like that. And
Oh, so they are not just confined to their room or to their
No,
bed,
no.
unless they are
bedridden. And
Okay.
if they're bedridden, we have nurses that sit and talk to them for sometime 15 minutes and stuff like that. And we will like read scripture reading to them because we believe that we believe in the Lord and we believe that there is much that He can do for us. So we have like little scripture reading. Some of them will just call you and say, nurse, can you pray with me? We don't tell them no or we can't do it no or we soon come. We just get on board and we pray with them and we read a scripture with them and stuff like that.
Okay. Alright. In a case where one of the residents become acutely ill, right? So for example, they're having a seizure, they start develop shortness of breath, or something to that extent. What's normally the procedure that you follow at this institution?
Okay. Okay. What we normally do, we have a situation like where we have a patient, she has like 4 seizures one day. We get contact with the doctor right away, and we follow instruction of what the doctor said, and we do what they were told. We don't stay back, we don't watch, we don't say we're going to observe at our home. We just rush with them to the hospital if the hospital is necessary needed.
Okay. So it's a case where you have a ambulance service linked to this, or just a reliable auto vehicle that you just can move at the same time?
We have both. We have an ambulance service and we have reliable vehicle.
Okay.
Also, I have a vehicle that I use at times.
Okay.
If anything, I can just rush out with them any time. Sorry, any hours.
Okay. All right. And in worst case situation, I certainly if you have it, like if a person die at the nursing home, how is that procedure normally? What's normally happen there? So
Okay.
God forbid someone dies at a nursing home, what they normally do?
Okay. In my situation, I experience it a lot of times. What we normally do, if a doctor has seen the patient in 3 months before the person died, what we do, we call the doctor, we call the family member, and we call the police.
Okay.
And the police come and we ask the various questions, like what they eat before they go to bed last night, what they eat this morning, depends on the time of day. And then the doctor will come in, yes, I see this patient 2 days or 3 days ago, and 3 months ago, and they will take it from there.
Okay. All right. Another set of persons at nursing home tend to be those that are bedridden, as I rightly said. Maybe they had a stroke or they just become extremely old and weak, right? And they are bedridden. Normally, those patients tend to develop decubitus ulcer, bedsores, or sometimes they develop blood clots, right? Normally, for those patients in hospital, we normally have them on heparin. Also, we have a ripple mattress, and we would also offer them limb physiotherapy, right? What measures do we take at nursing home to avoid blood clot and bed sores?
All right. I have persons that are bedridden right now, and what the doctor do, they prescribe aspirin, daily aspirin for them,
Okay.
so that they take on a daily basis, and we keep churning them on like every hour.
Okay.
We turn them, we make sure the area that we turn them after cool down.
Okay.
Because when the body gets very hot, it can lead to bed ulcers and so forth. We have a special ointment that we use. It is island-wide in all the pharmacy. You can get it, and you can get it overseas. People normally send it down from overseas that we use on their body, especially where the diaper goes.
Okay.
It's an A&D ointment. It's
Okay.
very good, and we have it in antibiotic also. So we use up our stuff on them, and we keep turning them like every hour, give them lots of water to drink and stuff like that.
Okay. All right. So in terms of nursing home, we know that in terms of the cost, what's the average cost per month for nursing homes in Jamaica?
It depends on what you want to charge. It depends on the level of the person that comes in and stuff like that. Because you have nursing home charging up to 200,000 a
Per
month.
month. Okay.
150,000. You have 130.
What's the lower limit? What's the lower limit for these? That you know.
I used to be at a nursing home, and the lower cost I see there is
85,000.
and that is for people who can move around. The people that cannot move around, you are looking at 130, 120.
Also in US dollars, a minimum 500 US, 500
Yes,
to 1,000.
500 to
1,000 US per month, all right, which would include food, toiletries.
It include like food, a clinical visit, 24-hour nursing care, and to keep the patient in good order.
Okay, all right, then you say additional
And
stuff.
that will come with like 3 meals a day. Some people give 4 meals a day, depends on how much patient they have and how much they charge.
Okay, alright, sure. Alright, what are some of the different staff members that you normally have at a nursing home? I know that the doctor will come and visit if it's an emergency or regular monthly checkup to refill prescriptions for those who require it. You have practical nurse RN, you have chef, and do you have like someone different to like help with the assisting daily living like bath and support different from the nurse, or the same practical nurse who just medicate and
Okay, we have the practical nurse don't really serve the medication unless you see where they're equipped enough to serve the medication.
okay.
But they like tidy the patient, assist them to bed,
Okay.
and assist them with whatever they want during the day. They're changing, they're tidying up and stuff like that. And the practical nurse go to a level of their help to tidy up the facility, keep their surrounding clean
Okay.
as best as possible, and they will help like to serve them dinner, feed those that cannot feed themselves,
Okay.
and stuff like that. Some nursing home you have practical nurse who cook, especially in the private home.
Okay.
In the private home you have practical nurse who basically do everything, wash, cook, clean, and do
Okay.
everything, look after the
Medicate.
patient and support medication
Okay.
and everything. So, but at the nursing home, we normally have our home chef, because we have our chef here. We have somebody that helps with the cleaning,
Okay.
the laundry, and stuff like
So we
that.
take the pressure off the practical nurse.
Take some of the pressure off them, because sometimes it's really become pressuring for the practical nurse, because one patient, she will attend into one patient, and the patient can be stubborn,
Okay.
and every minute, every 10 minutes, that patient call that practical nurse, and you can't tell them that you're not coming because you don't know what is happening to
Okay.
them. So you have to attend to them. So we get in other people to help them so that they can be there for the patient when they come.
Okay, alright, good. Now, in terms of the persons, I know that some, for example, some family member, I can base on my experience, like, even though some persons are perhaps elderly, they like to stay in their home, alright, where they live all their life, right? And what are some of the issues or complaints some persons may have? Like they probably get homesick when they're at the nursing home, like they miss their family, etc. How do you normally try to help minimize that stress on them?
Okay. First of all, the reason why some of them have to leave home, because home is toxicated. Too much is going on in their environment at
Okay.
home that they can't handle. Especially those that have schizophrenia, depression, and Alzheimer.
Yeah.
Too much is going on in their surroundings. So when they come to a nursing home now, we have to eliminate their surroundings, eliminate the things that happen at home.
Okay.
Try to get family member comes in as much as possible to look for them, but not to tell them the things that are going on at home.
Okay.
Because sometimes when you tell them about the things that going on at home, they miss it, they miss what is going on at
Yes.
home, but they are adjusting themselves not to hear it or seeing it.
Okay.
So when the family member comes in now, we do a survey and then we assess them to make sure that they have the right thing to say and they don't bring the news from home come.
Oh, especially if it's a bad news.
Especially if it's a bad news, it disturbs them, and then now the Alzheimer kick in, the schizophrenia kick in,
Okay.
and then it drives the nursing home in a chaos.
Okay.
Because they are going to carry on and get a little art style, and it's going to affect other patients.
Okay.
So we try to keep that on a low profile, not to get the family to come in and disturb their mind
Okay.
and drive them to that extent.
Alright. Alright. Any other issue that I had missed with nursing home that you would like to share with the public? What life at a nursing home?
I just want to say nursing home is not a bad place. your patient will get care, and you have nice nurse that wanted to be at nursing home to help others.
Okay.
And there is a thing that's called passion.
Yes.
You have to have the passion, the zeal to work at a nursing home, to take care of them. Because it's not an easy job to taking care of the elders. Because sometimes they ask you for a bottle of water, and you bring the water, and then say, no, I didn't want the water, I want juice.
Okay.
And then you take the juice for them, and they tell you that I don't
tea.
want the juice, I want some tea. So you have to have the passion to deal with all of that comes.
Okay.
And even those that are in their right mind will do you all of that.
Okay.
So you just, all right, for instance, I have a scenario today where a patient said, oh, I want to go on the trimming. And you put her on the patty, and when you put her on the patty, she said, oh, I don't feel like I want to do it anymore.
Okay.
You have to take her, you have to lift her.
Okay.
You have to lift her, take her off it. And then by the time you take her off it and said, okay, all right, fine, everything is all right. She called you 3-4 minutes after, I want to go on the party again.
Okay.
So you have to really have that passion to deal with this, because I have nurses that comes here and they was like, oh, I just clean you and you mess again and I will have to clean. I'm not doing it. I can't take this. You don't have the zeal to work in a nursing home.
Okay.
Because you cannot manage what comes.
Okay.
So you either have to walk or whatever. Even myself, I never find the passion, because even when I'm growing up my children, I was afraid of the feces.
Okay.
My mother said you get children and you can't. But guess what? Over the period of years, I have a friend that called me one day to help me with her mom. And it was a disaster. And I just started to say, okay, maybe this is what's going to happen to me when I get older, and somebody will have to be there. So I start to get that courage and that zeal till I end up working into a nursing home.
Okay.
Then I start to do private care, and the private care is much worse than the nursing home, because when you work at the private care, some things that happen to you, it's unbelievable.
Okay.
And you have to hold out. It's either you keep the job or you walk.
Okay.
But you have to hold out for it.
Okay. All right. Now, why should a part of this program is to allow the guests to advertise their business. But in your case, before you advertise the business, I want you to tell the public why they should choose your nursing home over the other 200 nursing homes that are in Jamaica. Last time I checked, about 200 nursing homes in Jamaica. Most of them not registered properly, but But about 200 nursing homes.
And it is more. It's
more? Okay,
there.
probably more.
It's more out there, but it's who that registered.
Okay.
I would say I don't look at my nursing home as a nursing home per se. I look at it as a home.
Okay.
A home for comfort, love, peace, and to restore. And I'm a Pentecostal woman.
Okay.
I believe in the Lord, and I believe that people that have certain sickness or whatever is going on in their life, I can minister to them and bring them to a certain level where they can get reconciled with the Lord and they can see themselves.
Okay.
And it goes on and on. And the passion that I have for old people, I just want to put that love out there.
Okay.
And I really and truly happy for those that choose me to take care of their loved ones. As I have a client, she said, you did not choose to do this, because how you do it, I don't know. I said to her, I don't know how I do it.
Okay.
But I know that the Lord has a hand in it, and He chose me for this purpose, to take care of those that are out there that need my care. So it's a passion.
Okay, all right. Well said.
And I just want everybody to see my passion. And it's not about the money. And I tell my clients, it's not about the money, it's about the passion that I have for your loved ones.
Okay. All right. So can tell the viewers where to your contact information or where to find you, etc.
Okay, I am in Mona at 18 Orchard Park, and my contact number is 334-8137, and my name is Christine South White. Everybody see me as Nurse White because of what I do.
Okay, and you have several years in experience telling that.
And I
nursing
have
home.
27 years experience in nursing home, in private care, in the hospital, and at home.
Okay.
Till I have a nursing home for myself now.
All right. I wanted to have several nursing homes for yourself.
I used to take my patient down to Malines Road at a lady. I meet her and I like her place, and I used to get the patient them and I used to take them there.
Okay.
Until she said, listen, I'm not taking one more. Go and get a place where yourself and do it.
Okay.
I'm not helping you anymore. I'm not taking one more. And I remember when I have a patient and she said, look here, carry her go your yard.
Okay.
I was like, what? I was like, I'm coming. Make a space. And I take her there and she said, this is the last one.
Okay.
So she helped to encourage me and drive me to having my own place.
Alright.
And I think it will expand. I can accommodate 10 people at this facility now.
Yes.
And I'm looking further to expand my business. I'm looking up to even having somewhere for golden age to come and live.
Okay.
And can do their own thing, can live and go, you know, like those that they have in England and stuff, that you can live and, you know, nurse accommodation, doctor accommodation on the building. They can call at any time for that care, you know, but they can go and like do their own shopping and stuff and cook for themselves, do things. Because they have people out there like that.
Yes.
They just need somewhere that they can press a button and get. Those people now, you see them as independent, golden age people. They don't lose their independence.
Okay. Alright.
So I am looking forward into that one day to come.
Okay, you believe in the Lord and you're putting in the work and you're working hard, so it will happen, alright? That's right. Alright, viewers, thank you for tuning into this episode about life at a nursing home, and I hope you find it beneficial today. So please share, like, subscribe to this channel. Until next time, stay tuned.
Be sure to subscribe for more informative contents on life, sickness, and death.